here to demonstrate a newborn exam. So we always start head to toe. So in real life I wear gloves, and I start and I hold the baby's head and I feel the posterior fontanelle. I feel the sutures. I check if there's overlapping. I check if there's molding. I check if there's a caput. I just feel and note the shape and symmetry of the head. I feel the anterior fontanelle. In the interest, because obviously this baby's not going to fuss, usually I do all the measuring at once, but right now I'm just going to measure. We measure the circumference of the head. We do it in centimeters. Then I come down and we go to the eyes. And we open kind of each eye and look at the sclera and check the color, make sure there's no hemorrhage. We would like, clear, bright sclera. If these parents want erythromycin ointment, we do that at that time. You pull down the lower lid, you squeeze a ribbon of ointment and just go on the lower lid. 1, 2. We check the placement of the eyes along with the top of the ears, make sure that's level. We look at the ears, make sure it's complete. We check the nares to make sure they're patent. I will put my finger in the mouth to check the suck reflex and to check to make sure that there is a complete palate on top. We also at this point look for a lip tie and a tongue tie. We come down, we feel the jaw, come down. Now we're at the clavicles and we feel the clavicles to make sure that they're intact, that there's no crepitus. We come down to the arms. At this point we'll do an axillary temperature for baby with a quick read thermometer is best, quick read digital, the Vicks. Then we move to the chest and we will measure the chest at the nipple line. We also happen to do that. Oh, this is on inches, but our practice does it in centimeters. I'm going to check the nipple buds, make sure they're symmetrical, evenly placed, and we feel them. Sometimes if they're not, if they don't feel 9 or 10 millimeters, I will actually take out the tape measure and actually measure them. We come down to the umbilicus. Actually, since we're just completely doing this head to toe right now, we're going to listen to the apical heart rate for a full minute to get the rate and rhythm. I also will count respirations for 1 full complete minute. I could do that by listening to the lung over here or just putting my hand on the belly and counting respirations for a complete minute. Come down to the umbilicus, and we have just cut the cord at that point, and look and make sure it's not bleeding or oozing or anything funky with it. We listen to the bowel sounds, all 4 quadrants. You just need to hear the click in each quadrant, and we move on. Move down to the genitalia. If this baby is male, then we feel the testicles and make sure they've both descended. We check for the placement of the urethra. We want to make sure that it's in the center of the penis and not above or below for hypo or hyperspadias. If it's a girl, we just note how covered the labia are. We come down, legs. We're going to do reflexes. I did the grasp reflex with their hands. We're going to do Babinski on each foot. We're going to do plantar on each foot. We're going to do stepping. We have noted the entire color of the baby, make sure the baby is oxygenating well. We're going to note if there's any birthmarks on the skin. We're going to note if there's any lanugo, if there's vernix. Just do like a once over. When we turn the baby over, we can listen to lungs at this point in 6 spots. Make sure that the lungs have inflated. Actually, here, I usually do 1, 2, 3, 4, 5, 6. That there's even expansion. Make sure there's no rails or crackles or fluid going on in the lungs. We feel the spine and look to make sure it's straight. We look to make sure everything is closed and complete here. We're going to look at the top of their little butt crack there and see the little dimple and just kind of take a look at it and make sure, just note if there's any tufts of hair or to make sure it's complete. As we come down, we're going to check their creases. We want to make sure their anus is patent, which is, we just test that by their meconium passage. We come down to their legs, make sure that their creases are even and that their legs are even. Is there any? Oh, and at this point, if they would like an injection of vitamin K, we do that at this point here. I think that is the complete newborn exam. And I will either redo it or add on if there's anything I have forgotten at this point. Thank you.